Okay, there we go, guys. Looking pretty good. Got Susie Q to be the line master here. Yeah, look at those fries. You got the Polish there.
Yeah, Polish and it's all
I've never
decked
seen
out.
fries like that. It must be some special
They call them sidewinder fries.
sidewine. Good evening, DJ Wonder Chrissy, and today is Monday, February 5th, 5. Doing a late evening show. We were out doing some traveling. If you can't tell, I am ready for spring and summer. Got the Cubs hat on here, and also today we drove by Brewer Stadium, also known as American Family Field. They had the dome open, so I was surprised that they had their retractable dome that was open. I don't know how they what they do to wake up the grass if it gets too cold, but they had the roof open up at Brewer Stadium, which we like to call it there. County, used to be called County Stadium. It was Miller Lite. It was a Miller Lite Stadium at one point too. They changed the names up there so quickly. But anyway, so we're looking for spring training to start. Things are still a mess in Chicago. I'm going to share with you how the healthcare industry is kind of imploding here. We've got two hospitals with issues. One is Lurie's, which is they got a huge network. It's really don't know what's going on there. It's a cyber attack. All we know, seems like it's impacting more than just the downtown location. It is impacting their medical records, but they're very, very quiet about it. No one's sure if there's a ransomware request or who's responsible, and and for you folks in Madison, Wisconsin, just FYI, their medical records system is Epic, which hails from Madison, Wisconsin. Epic Systems or Epic Medical Systems. I can't remember their official title up there, but it's a huge company that rose to dominance in healthcare during the Obama healthcare days for some reason. Interesting company. They're utilized by many large healthcare companies. So let's see here. I need to set this one up. Where are we at? We need to find our Lurie's video, and let's see if we can find it here. See if we got it here. Not showing up just yet. Let me try this again. There it is. There we go. So let's play you this clip about Lurie's Children's Hospital, one of the probably the top 10 children's hospitals in the United States. So let's play this one for you.
Children's Hospital stretches into its 6th day. The hospital
6 days. Wow, it's lingering. It's going to linger a little bit longer.
Taken its computers, internet, and phones offline because of an unspecified cyber attack. It's caused families with appointments and Chicago area pediatricians in the hospital's network to find a workaround.
At first, we had some patients having trouble communicating with their specialist down at Children's, but we were able to back channel that in a couple of ways.
Dr. Andy Bernstein, a pediatrician at North Suburban Pediatrics in Evanston, says the outage has no impact on emergency services and that Lori continues to alert families of the outage with notices on its website and social media. The hospital also announced a separate call center for patients to get prescription refills or to ask non-urgent questions about care or appointments. Bernstein says he's also fielded some questions from his patients.
I actually had a patient call me who was unable to get in contact with their family's neurologist over at Lurie.
Providers still do not have access to all patient records, as many are only available digitally. Lurie has a network of hundreds of pediatricians, and Dr. Bernstein says even before this outage, there were many lines of communications between doctors.
Lurie's made sure that they're able to be in good contact with their referring specialty, or with their referring general pediatricians.
The cyber attack is still being investigated. Sources with the FBI say the agency is aware of the cyber attack and is providing assistance. In the meantime, it's not known when the network will go back online.
So that's a big deal, folks. Think about this. So in their hospital, they got to have some method to track everything that they use. It's no longer computerized. I mean, in some of these pills and treatments, pills and treatments can be hundreds of dollars for a pill, right? Or even a treatment, or some type of Band-Aid or anything. I mean, you can $50, $60, $70 when you're in the hospital. So if it's not being kept properly, the hospital's going to take a loss on that. And if this becomes big enough where the hospital does lose millions and millions of dollars, I mean, they could be losing millions in a day. Let's just face it. That's just a conservative estimate. I'm thinking a couple of million easily they could lose in a given day, just because going to a manual process and things get lost between the tracks, right? And who's going to pay for that in the end? It's going to come back to you and I, the healthcare paying individual who's paying his premiums. You're going to see your premiums go up because hospital costs just happen to go up. So now here's another. If it wasn't just for that, we have another hospital in Lake County, okay? And it's not related to the migrant issue, but let me just tell you that they did send some migrants out to Lake County and gave Lake County some money. So there may be some distant relationship to this, but I got a feeling that this hospital here was having problems for a while before the migrants showed up. And I'm not sure exactly how many migrants JB and Brandon sent out to Waukegan. This is based in Waukegan, up north by the border, close to Kenosha, and in that area, the Illinois-Wisconsin state line. So let's listen to this report about this hospital that's been having some issues for a while, and it's come to a head, at least from a trauma perspective. They're not going to be able to take in any trauma victims. They just lost their rating or certification or whatever you want to call it, and we could be seeing this hospital go under in the near future if things don't turn around. I read an article about this about a week ago, and it didn't sound real rosy from a financial perspective. And let's see what NBC5's got to say.
Suburban hospital that could have major impacts for people who need critical care.
State health officials removed the trauma center designation from Vista Medical Center East in Waukegan. Christian Farr explains what this means and how patients could be affected.
What the community is most concerned about is this hospital going out of business.
Waukegan's Mayor Ann Taylor has concerns after the city's level 2 trauma hospital lost that designation following an investigation by Illinois' Department of Public Health. Last Friday's announcement came as a surprise to the mayor.
I really thought that they would have reached out to myself and other elected officials and told us about it. A report like that doesn't just happen.
Heart attack and stroke patients, among others, may not survive a drive to other hospitals in Lake County.
Today, the Lake County Coroner's Office held a press conference to inform the public about IDPH's investigation of Vista Medical Center. IDPH says it revoked the level 2 trauma designation because the hospital lacked a blood bank, anesthesia, a full-time trauma coordinator, and other things required to properly serve the community.
American Healthcare Systems is responsible for hospital operations and must immediately take action to protect the community and correct these deficiencies.
This is a serious issue.
State Senator Adrian Johnson was also caught off guard.
Now, the article I read, I can't remember who wrote it. I think it was a local newspaper. They stated that like a week ago, part of the problem was they didn't have doctors and nurses on staff, and what they would do, they would pay them per procedure. So if they had like an anesthesiologist, they would pay him to come in and do a couple, and then he would bill them and he would get paid. Well, that model was starting to have cracks. They had anesthesiologists that hadn't been paid. They were no longer going to do any work there, and it left the hospital in a real tough situation. And as we see here, this was bought out in July by a new company out of California, American Healthcare Systems, and it sounds like they've just financially run it into the ground. So I don't know where this is going, but we could see this hospital close real quick, folks.
About the investigation, but had been talking to Vista leadership for weeks about addressing issues with the hospital. State Senator Johnson is still in constant contact with hospital leadership and feels confident that Vista will not close in Waukegan.
They are fully invested in this community and want to do their part to make sure that Vista stays in Waukegan.
Lake County's Department of Public Health says that they have seen an increase in hospitals around the area after Vista lost that designation. As far as a timeline as to when the hospital will fix these problems, that still remains an unanswered question. In Waukegan, Christian Farr, NBC5 News.
Thanks to Christian.
So there you have it. I don't know what healthcare systems are and the hospitals are in your area, but here in Illinois we've had a lot of consolidation. I mean, actually I know some hospitals that have probably been consolidated in the last 10 years 3 or 4 times by different companies. It just keeps consolidating and consolidating. I also know of several rural hospitals, and I think there's actually another one in Waukegan that closed down probably 8-9 years ago. I know there's one in Spring Valley that had a ransomware attack, and they decided when that happened they weren't going to pay the ransom, and they just closed the doors a month later. So there's a lot of rural and smaller hospitals that are, if they're not consolidated or they got problems so bad they can't consolidate, they're just closing the doors, folks. Just closing the doors. So that's what I have for you today. It's not real rosy and happy if you're looking or needing a hospital in the near future in the Chicago area. You might want to, think about all this and keep some notes on your medical status and this and that, because I know a lot of these hospitals, even if you're not in the hospital, if you're just going to see the doctor, what they call doctoring, all your stuff is kept online. And as I said, one of the major vendors of that is Epic. And I know that Epic software, sometimes hospitals house it in-house, and they have all the servers and the files within their hospital data center. And even Epic does provide a service where you can utilize their software over the internet virtually, and you don't have to do all the technology issues and maintain that stuff yourself. So I'm not sure which one Lurie's was doing, if they handled all the infrastructure themselves or they were purchasing the assistance. If they were purchasing the assistance, we got bigger problems, folks, in the healthcare industry. But they're pretty tight-lipped about this whole thing. Not much is being said, so we really don't know what's going on. The only other bright sign today is I'm hearing Metra, the Chicago Metra suburban train line that runs 11 different routes from the suburbs to downtown Chicago, went to a new fare system and a new ticketing system, and it flopped on its belly late last week or the middle of last week. They're saying it's back up today, but it's having some minor issues, but should be back in line in the next day or two, 100%. So, and I'm an old IT guy, so the stuff I'm hearing coming out of Metra doesn't really make a lot of sense, because when you architect these types of systems, the architecture's got to be right, and if it's not, you have problems. And we were told that this system was purchased through a company that was offshore or overseas and has done this before. So I don't know all the details about this company and how large of cities and user base it dealt with, but it doesn't seem to be able to handle the volume that Metra is handing its way. So a lot of answers to be coming there, because we're not hearing much from Metra. As you do with any government agency, they're pretty tight-lipped, especially when things go south. So let's hope that we get some more readouts on what happened at Metra and how they're going to make sure it doesn't happen again, because right now people are getting free rides on Metra, and we'll see what happens tomorrow. But there was a report today where Metra said they were up for part of the day, and then it kind of went belly up. So that just doesn't sound good to me from a technology standpoint. It either works or it doesn't, right? And if it was working and then it quit working, that just doesn't seem right, and it means major problems. So that's all I have for today. Sorry for not getting out my normal show in the morning. Was doing some videotaping for Susie Q Slots up in Milwaukee this weekend, and we'll have some of that content for you in the near future. And we also made a stop at one of my favorite spots, Lulu Bells in Muckwonago or East Troy on Lake Beulah. We'll have we'll have some shorts there. We had a wonderful lunch overlooking frozen Lake Beulah, which is still pretty frozen, but most of the other water sources up there are clear right now of ice and waiting for spring, as I got my Cubs hat on. I think spring training is just around the bend, folks. So hope you're saving your money. To be able to get to Wrigley Field, you got to pay big bucks, folks. And I haven't been to Wrigley Fields in many, probably 15 years. But we do every once in a while make it up to Brewers Stadium in Milwaukee and enjoy a nice ball game up there every once in a while. So that's all I have for today. DJ Wonder Chrissy for Migrant Mayhem and Hospital Central for the last couple of days. We're reporting on all these hospital issues. In the Land Cruiser Midwest, like, share, and subscribe if you will. Appreciate you guys. We need help with that algorithm. Over and out, DJ Wonder Chrissy.